Okay. All right. Well, good evening, everybody. Thank you for coming tonight. As Amy said, my name is Sean Grady, not Sean Hayes. The gentleman sitting behind me is John Weber. He's our deputy director. I am the director of the agency. And we've got two presentations for you tonight. The first one is about setting up a shelter and the differences between, for any of you who might have been involved with a Red Cross shelter, and the differences between that type of a shelter and a typical warming shelter, how we set it up and how we're running it here in this county. The second part of the training would be for cold weather injuries and how to see those and what you might see in the field and how to treat them. One thing that I do want to reemphasize from Amy's point of view is that if you do have a question, please put it into the chat. We will get to it at the end of each presentation, and then we'll kind of double back and answer those for you. So unless anybody has any questions now, I will go ahead and get this thing started.
Sean, I realized I forgot to ask people to put their contact information in the chat room as well. So many people are identified by their name. If you are interested in being contacted about future volunteer options for emergency warming stations when they're needed, if you would please put your preferred contact information in a chat message to me specifically, to Amy Dell, that would be great. I'll capture that information and it will only be shared with the Warming Center Task Force.
And as we do that, just to kind of reiterate that a little bit, one of the reasons for it is currently all of our shelters have currently been located in the city of Newark. Our goal is to eventually be able to offer this option throughout the county. So it would become more and more important to have a listing of volunteers throughout the county, not just in Newark, to be able to house and staff these sites. So it's a lofty goal, but we work towards it, little baby steps. Let's see. So anyhow, a couple of things I wanted to touch on first is some of the participants in this warming task force. For those of you who are not familiar with us, it's made up of a combination of government agencies, nonprofits, and grassroots groups. With some of their logos here, Licking County Foundation's involved, of course. They're hosting this meeting tonight. United Way, the Licking County Health Department, Salvation Army, who's been a fantastic partner from the beginning, the Licking County Coalition for Housing, Vertical 196, which has been, they've been influential in our transportation options and getting homeless folks out to the shelters. The Newark Nazarene Church, which also has participated in that. Licking Memorial Hospital, which has helped us with training and with some supplies. Mental health and rehabilitation. Pathways 211, the Disciple Factory, which without them last year, we would not have had a shelter. And we would be remiss in not mentioning the Crossroads Crusaders. They were the boots on the ground and participating and making sure a lot of this happened in conjunction with Disciple Factory and Spring Hill Baptist Church. Emergency management has been involved with this, representing the county from day one. We are also we end up supplying quite a bit of supplies to this effort as well. So with that being said, let's keep going. This is actually a series of photos from shelter setups that we did when I was back in Massachusetts. These are actually Red Cross shelters, but it kind of gives you what I wanted to accomplish with this is that a shelter is not just a room with a bunch of cots in it. There's a lot more to this, from registration, whatever that might be, and I'll explain that in a little bit, to feeding, to where you house the folks, to a place where they can get away from that that sleeping area, which is normally kept quiet and hopefully somewhat dark, and be able to go out and watch a little TV and get something to eat. But it takes more than one or two people to run one of these things, and there's some significant differences. And I'm going to say this a couple of times throughout this presentation, but there are some significant differences between what we're doing here and what Red Cross has done throughout the country, and what a lot of us have seen in news reports in relation to wildfire evacuations. You'll see them with earthquakes, you'll see them in hurricanes, and that's typically where we tend to see this with Red Cross. Red Cross is involved with this effort with us as well. They provide quite a bit of supplies to us as well as training material. Some more photos from things that have been done in the past. These are all, again, out-of-state people. Different things from setups, feeding, cafeteria operations, logistics, how we run these things during the day, and how we get them replenished for the next day in case you have to run these for multiple days. One of the key differences between a Red Cross shelter and a warming task force shelter is that we close every day. The warming task force shelters are typically opened up from either 5 p.m. or 6 p.m., and they'll turn around and close 8 a.m. or 9 a.m., where all the residents are back out and outside of the shelter. Red Cross shelters are typically operated 24/7, and they will run from the day you open it until the day you close it, with a wide variety of people coming in and coming out. You're going to see, and it might be the next slide coming up. No, this is actually a photo taken from Central Christian in our very first warming shelter that we opened up in this county from January of 2019. Reverend Gill and Central Christian was kind enough to host the site. But this gives you an idea as we took cots supplied by Red Cross and by us and kind of set up an area so people have a place to call their own, be able to put their stuff. And typically we're matching up to a Red Cross shelter, you would see a chair next to each one of these cots as well. So they have a place to sit and, kind of talk amongst themselves. I believe it's the next one. No, I'm wrong again. All right. One of the things we did want to address that is completely different this year from other years is some of the things we're going to have to do coming into this season to address COVID-19. We will be providing thermometers to each and every site that's opened so we can take temperatures of all inbound residents and volunteers. We are going to try to the best of our ability to maintain 6-foot separation of cots. That is really dependent upon the site and the need on any particular given evening. So there might be some give and take as far as that is concerned. One of the keys that Red Cross is recommending as we deal with COVID-19 is that cots are no longer all facing the same direction. It's going to be alternating head to toe, alternate orientation, so we can try and keep people when they exhale away from, so we're increasing that distance from the folks. Face masks will be required, and they will be provided if people do not have them. We will also provide sanitizer for staff and residents into each site. If anybody is feeling ill and they are going to be separated whenever possible within the site, again, this is going to be site specific. So depending on the site, hopefully we'll be able to determine that we've got a room or two separate if somebody's not feeling good, so we can keep them away from the general population. And as much as we love volunteers, but if the volunteers are not feeling well, even if they've got just the sniffles, at this stage of the game, we're encouraging them to stay home, which is one of the reasons that we're doing this training, to try and encourage more people to sign up as volunteers. So again, if you've got any questions regarding any of this, put it into the chat. Now, I would encourage each and every one of you to take a look at this. I'm not going to show this. This is a 45-minute video that Red Cross goes through showing the basic shelter operation and the steps on how to run a shelter. We're going to talk a little bit about that in a couple of the upcoming slides. But if you want to take a moment and write this down and take a look at it on YouTube, it's a very good training video. Red Cross uses this for all their onboarding for potential volunteers. So it gives you an idea, but I'll give you 30 seconds or so to write that down. And remember, when you're writing these URLs down, they are case specific, so capitals and lowercase. And this will still be embedded in the video, so if anybody wants a copy of it, at the very end, my email will be up on the last slide, so you'll be able to send me an email and I can send you this link as well. Okay, if everybody's had a chance to write it down, if you haven't, and I need to come back to it, just drop a message into the chat and we will come back to this either at the end or I can do it in a minute. This is actually a Red Cross shelter process. A lot of people believe it opens up, it starts at the bottom with opening up the shelter. And we tend to believe that it actually starts at the very top with planning and preparedness, where we sit down and we think about how we're going to be doing this in this upcoming season or during this upcoming event. You have to look at your sites, your potential sites, how they're going to be set up, how you're going to lay them out, how the volunteers are going to deal with the flow of the traffic coming into the shelter, how you're going to resource the shelter. Do we have the resources? If not, what do we have to do to get them? And then how are we going to get them there the day of the shelter operation if they're not housed on site? Once we open up the shelter and start admitting residents, how are we going to operate the shelter? What are the hours of operation? When are we going to shut the shelter down at night? What I mean by that is that these shelters are not, typically we try and shut them down around 9 or 10 o'clock at night, where it will no longer accept inbound residents. The transportation has stopped, and we basically go into like a quiet time. Residents should not be leaving the site at that point. And if they do have to leave for whatever reason, there has to be some consideration given that they're not coming back, or they have to be escorted into the parking lot or whatever. We try and not let any residents go out unescorted, just because of the potential for drug use and any potential issues with security. One of the biggest processes for us is, since these are low barrier shelters, and I'll explain that in a little bit, but since they are low barrier shelters, we are very concerned about the safety of not only the residents, but also the volunteer workforce. And we want to take every precaution possible while respecting the privacy of the resident, of the homeless resident. And during that process, and you'll see in a little bit, but during that process, we're also trying to get as much information as we can about the needs of these residents, so we might be able to get them set up with, potential programs in the that are available within the county to address some of their needs. Typically, when you open up the shelter, when you start planning for the opening of the shelter, you are already planning the closing of the shelter as to what time this shelter is going to be shut down and what time the transportation will be coming to pick up residents that need to be transported somewhere back to where they originated from. All of that should be pre-identified and should be part of our messaging that goes out to the public prior to these shelters opening up each and every day. Typically in the past, we have done that. Olivia Biggs, who is the PIO for the County Health Department, is also Emergency Management's PIO, and has done a fantastic job these last 2 years of being able to push out messaging to the public and get this out through the media, so people become aware of, this site being opened up. So again, it just runs through that cycle, and this is a continuing cycle. We actually still go through this whole phase, even in the off season. Supplies were ordered in July to make sure that we had them here, in time for this upcoming season. And in the process, we were also competing with everybody trying to get supplies for COVID. So there's a lot of parallel preparedness going on here. A couple of different types of Red Cross shelters. Again, evacuation shelters, which are typically used for large fires, wildfires. General population shelters is a little bit different in how they're set up, but those are typically for mass evacuations for like hurricanes on the coast, when they know that a very large population is going to be leaving an area and going to be needing, setups. Red Cross typically will operate using a 10% rule, looking at roughly 10% of the population that's being moved. We don't have to deal with that in this issue, so we're just making ourselves available. Typical Red Cross spacing for a resident is 5 feet by 8 feet from where their cot's located, or 40 square feet. We do tend to set up areas for people that need additional space. That might be a young mother with a baby. It could also be a couple of family members that are experiencing homelessness coming in, and we want to kind of set them up and be able to provide them with a little bit of privacy. So we try and take that into consideration, and it's all based off of the needs. So to get that information, we have to try and get it and be able to address that need. So part of this is done through an initial shelter site evaluation. We're still in our infancy in this program. We don't have the luxury at this stage of the game of refusing sites. Typically, we would like to get to the point where we're trying to find the best suited sites to meet the need in the areas that we're trying to put these sites in. Some of the things that we are required to look at, and we follow the Red Cross model with this as much as we possibly can, but entry and exits into the building, is it ADA accessible, the Americans with Disabilities Act? Preferably, because a lot of these cases we're doing this in inclement weather, does it have backup power? It doesn't do us a lot of good to open up a shelter to have the power go out. So we prefer to have sites that have backup power, or at least on a priority grid. Is it possible for that site to provide separate rooms for sleeping in a general lounge area? Again, that's very useful. There are people with very widely diverse sleeping habits. Some of us like to go to bed early, some of us like to go to bed late. And there's nothing more irritating than when you're trying to sleep when other people are sitting in the room talking. So we try and separate that out as much as possible. If possible, does it have multiple sleeping areas so separation is possible? If it's an issue, is there an area that can be designated for male and for female, or for families, if that's the case? Preferably, is there an outside area that's relatively secure, fenced in, away from situations where if somebody is still using drugs, that they're not trying to meet their dealer. It's not something that we want to deal with. One thing that we want to touch base on here a little bit is that low barrier shelters, basically we're not collecting a lot of the information. A lot of these folks don't want to give us their names. There might be warrants out for their arrests. So these shelters do not have law enforcement coming through them, and we do not share this information with law enforcement. The only thing that we do every time a shelter is opened, we will notify the local fire department that that site is being used as a shelter overnight, just in case they know that if they get a call through 911, that there would be a potential issue, and to be aware of it. Is smoking permitted? And that's up to the way we've written our standard operating procedures for this warming task force, is that we leave the smoking permitted up to the actual site. We discourage it. The county discourages it, the health department discourages it. But we realize quite a few people still smoke, and that's fine. But we do not want smoking allowed in the building. That's something that we don't want to do. But is smoking permitted outside, and will they allow? What are the hours? What are the rules? So we give the facilities a lot of flexibility to set their own rules, working within our guidelines as much as possible. Is there a kitchen on site? Is there ability to cook food or warm food? A lot of the food that's being provided to these sites is through donations. And in a lot of cases, it's donations through either warming task force contacts, or it's donations through the parishioners of a church, per se, if we're doing it within that group. Or like in the case last year, Crossroads Crusaders and the Disciple Factory was able to acquire food for each night we operated. And then there's much more to this as well. I mean, the document is actually about 15 pages long if we follow the Red Cross model. We're picking and choosing things that are really appropriate at this stage of the game. If we're lucky enough to get this off the ground and do a little bit better this year than we did in previous years, eventually we would like to get to the point where all of the sites kind of comply with, that thought process or that idea. So we're not running multiple rules for multiple sites as much as possible. While we try and find sites that have everything listed, it's not always possible, and we have to be flexible with this. These shelters are distinctly different from Red Cross evacuation shelters. The core services will remain the same, but since we are low barrier, there's a few things that we don't do. We typically don't go through that normal registration process. We don't go through a formal security process where they're emptying their pockets. We're asking about it, and again, that's site specific. We would like to ask about it, make sure that weapons aren't coming in the door. But we've got to be realistic. Is the key here, and our goal is to get the people off the streets into a warm location. Typically, and currently, our triggers for this for doing this is 10 degrees, and we use that 10 degrees being forecasted at the Heath Airport. In emergency management, we monitor that all the time, anyhow. So if we see that the weather forecast, and typically we can forecast this out a couple of days. We will advise the executive board of the warming task force as we're looking at a likelihood, and we'll start making arrangements. Typically, and we've done this in past years, we will not make the decision to open up until it's about 24 hours prior. And we try and hold to that with announcing it 24 hours prior. So even if the weather changes, if we've announced it, we will keep it open. We're not going to backtrack on that. But it is very important to know the differences between a Red Cross shelter and a low barrier shelter. They are two distinctly different things. So some materials that are needed to run these operations and logistics. Logistics is basically everything that is not handled through volunteer donations. Movement of the supplies to the chosen site that will be used as the warming shelter, and allowing time for setup of this. So if you're going to open up and start bringing residents in at 5 o'clock, we'd like to have this stuff moved over to that site by 3 p.m. and get it set up. It doesn't take long to do it. It's just something that we need to do. Ideal situation would be for the chosen sites to keep the basic material on site. Doesn't always work that way, and it is what it is. If sites can't house it, then we will be looking at a central accessible storage site. Right now, Salvation Army is housing some of this gear, and we're housing some of this gear as well. Purchase of all non-perishable gear for the effort so far has been done by us, and I've got a shout out to Salvation Army as well. They've also purchased some gear for this. The food, again, is usually donated. We have not had to pay for food yet that I'm aware of. I could be wrong. So different material, some more material that's needed, signage to show the residents where to go, office supplies for registration purposes to keep records as to who's coming through as much as possible. I'll get to that in a little bit more. The actual cots themselves. The cots that you've seen in the pictures so far are actually a little cumbersome to set up. There are some newer cots that Red Cross has been providing us. They're a little bit easier to set up, but it does take a little bit of time to do this and get it set up right. Blankets. We provided blankets this past year, and we will be providing them again this year. We've also purchased comfort kits, which are basically little kits about this big that have travel size, of deodorant, shampoo, toothbrush, comb, that sort of thing. And then it has it's kind of a really cool, it's about the size of a quarter. And when it hits water, it expands into a washcloth. But that's all provided, and we have enough to hopefully go through the season. The site hopefully provides tables and chairs in a lounge meeting area so they can, the people can actually relax. And then food, snacks, water, warm beverages to include coffee, hot cocoa, that sort of thing. If possible, charging stations for cell phones, because people do bring cell phones in. Most of these sites already have fire extinguishers on site. We want to make sure that that's still there. Emergency management provides a very large first aid kit for each. Last year we did it for 2 sites. We've got 2 again for this year. These first aid kits also include Narcan in case of any potential drug overdose. We ask that the site keep track of what's used so we can start the reordering process or the replacement process in case we're running, as an example, let's say we're running a polar vortex where we're looking at 4 or 5 nights in a row of this, then they might not have enough gear on day 1 to take them through day 5. So we need to replenish that every day. And that's a little bit more of a challenge this year in COVID and pandemic situations because our time is being pulled in other directions as well. This is a typical shelter inventory sheet that Red Cross uses. We've actually created a couple versions of this that we provide to the sites on the front end. It's just a suggestion. It's just a way to keep track of what's being used. And then we've got something to go off of so we're not guessing the next day. Initial setup of the site. Do they already have the gear? Does it need to be dropped off? Will they need assistance setting it up? In some cases, they've got volunteers to pull from. In some cases, we have been on site to help them in the past. If the site has a cadre of volunteers, that's actually phenomenal. Typically, we would ask, just like with this training, we ask the volunteer to go through a mini version of this, just so they're not surprised as to what they might see. And so they have some level of expectation to get through this. Is that site capable of doing multiple days, or do we need to shift sites? Do we need to open up a second site if we're lucky enough to have one available? as I said before, typical hours will run from 5 p.m. till about 0900. We do have arrangements with Newark NAS. I know Vertical 196 and Licking County Transit also has offered use of their buses to be able to move people back to, and typically Scott Hayes, I know, is currently working on a route as to where we will be picking people up during the course of a given evening. And what we try and do the next day is we reverse that route. So as people are disembarking from the shelter, back onto the buses and back to where they were picked up. Then they can go back to where they came from. It would be, in a perfect world, as part of the vetting process for a site, it's ideal to have a physical layout of the site so we know how we're going to be doing this. That way, inbound volunteers have a clue as to what they're going to be looking at. It's not always possible, but as sites are used in over multiple occasions, people get more and more familiar with it. I'll just say it's a little odd to give a presentation where I don't have immediate feedback from the audience. So, I hope that I'm not going too fast and people get an opportunity to see this. So again, if you've got questions on the back end, let us know and we will go back and, and answer them too. So everybody's squared away as far as what we're doing here. For registration purposes, we did create a very basic form. It's similar to the Red Cross form. Some people are not going to give you any information at all. In the event that they don't give you information, we're still going to try and get some of the basic information as to who this person is, what their gender is, what their approximate age is, basic description, hair, height, weight, anything descriptive about them that will assist staff in relating to them. And this is important because you don't want to be operating a shelter and have to address somebody as, hey, you. So this gives us the ability to try and, if there's through observation, you determine that somebody has a need, you can now relay that need to someone else and they know who to deal with. And it's not just, a name or a number. We're trying to make this as personable as possible because one of the secondary goals, besides providing a warm place and a warm meal overnight, is to also try and identify any of their needs and then hopefully line them up with help from any of the various agencies or grassroots efforts. You'll see it, and the basic registration form that's provided to the sites will also give you an idea. So it's essentially don't chase them down for it, but get as much as you possibly can. And this is the simple the simple registration form that we're using now. Fill it out if possible. Some cases they might give you a false name. Again, there is some concern from some of these folks because of outstanding warrants that they're afraid of law enforcement coming in. And, we have commitments from law enforcement currently, as long as there's no incidents at the shelter, that they're not going to be coming and looking for that stuff. So, anything that identifies that person is ideal for this type of a form. And again, this is suggested. And this is also, if the site wants to use it, it's available. And this is part of our standard operating procedures in that format. We send this out to every new site. So they have this information and they can then make their own decisions as to what they want to do. A couple of rules with feeding area. First thing and foremost is feeding areas are kept separate from the sleeping areas. These areas will vary from shelter to shelter. Not all of them will offer every piece. There might not be a snack and beverage table. It might only be bottled water. Excuse me. The dining area might not be separate from the general lounge area. Again, perfect world, all of these places are separate, but we will take what we can get at this stage of the game. Try and get as creative as possible. Whatever you can do in a particular site that will make it a little bit more homey and a little bit more welcoming is very welcome by everybody involved. Communication for staff, essentially, we want to gather that information, the individual folks that are volunteering. So we have their cell numbers and so we can text between us. We know who is working in the site, and then if there's any concerns about a particular resident or behavior of a particular resident, all of that information can then be sent out. Again, we're trying not to alarm the residents, but we want to be able to push this information out so all of our volunteers and all of our staff that's working in these sites are as knowledgeable and as aware of the situation as possible. external communications with others, basically it's our ability and the warming task force ability to reach out for volunteers, as the sites become available, as the need is there. So we're trying to, as Amy mentioned, we're trying to gather folks that are willing to do this and are willing to be notified about an available opportunity and possibly willing to volunteer their time. Site security will change based on the site itself and what the rules are from that particular site. We're not trying to intimidate residents, but to provide for the safety and the safety of the volunteer staff. We want to be able to do this on day 1, and we want to be able to do it on day 50, if that's where it takes. We want to be able to not burn out the staff, but to provide for their safety and security so they're willing to come down and help us out. This is also tied to the recommendation to not let residents leave after 9 p.m. If the site decides to allow this, our recommendation is that they have a staff member make sure that the person leaving is visible at all times. One thing we've learned is that the residents can push you. If they want to do something and you're telling them not to do it, they will push you. They will threaten to leave. You've got to be willing to let them leave. Don't bend the rules, because once you bend the rules once, you will be bending it every time. And we've said this time and time again, and I've had some discussions with previous sites where they didn't believe us during the beginning of it, and afterwards they said the exact same thing. You were right. We did get pushed. In one particular incident, they had a homeless person that was 8 months pregnant threatened to leave at 2 a.m. when it was 10 degrees outside if she couldn't go out and meet somebody. Turns out she was meeting somebody for drugs. So it happens. You just need to be aware of it. Water is allowed in the water or baby formula if there is a baby or an infant in the warming shelter. Otherwise, we must enforce the no food in the sleeping areas for cleanliness reasons. Remember, these sites are being kind and they're offering up their site. We're trying to keep these as clean as possible. We're also making sure that there's no bugs or whatever else that are there. And by allowing food into areas that it's not normally there, it's just inviting mice and other types of unwanted creatures. Since food is typically provided at these sites, we discourage them from taking multiple things of food and putting them in with their gear. If they want to grab that stuff on the way out in the morning, they're more than welcome. We just don't want that stuff leaving the area where the food is being served. And again, this is up to the site, but it's a good rule to follow. This is key, and this is, we encourage every volunteer to do this, is to have a conversation with these residents. This is the best way to discover unmet needs. It's also a very good way to identify what they might need, and so we can line them up again with the various agencies throughout the county, both governmental and non-governmental, nonprofit, to get them the help that they need. Some of them want the help, some of them don't want the help. We just need to be able to make it available if they choose to take it. Closing the shelter. Again, we should have had a time set aside for this at the beginning. We want to make sure that that's clearly communicated to the residents so they know what to expect in the morning. Afterwards, after everybody's been moved out of the shelter, we will go, you want to be able to, the volunteers should be able to go through, pick up the general trash. Usually the site will do a walkthrough to make sure that there's no pests there. Doors weren't left open, there weren't mice in there, that there's nothing left on the cots. Cots should be cleaned and treated if necessary. We do have in the warming task force, we do have a provision to be able to provide money back to a site if that is needed. Restocking of supplies that were used, that's identified and transported to them, especially if they're going to be doing multiple days. And then again, if not, if we need to be taking that stuff off of the site and moving it back to storage, we will do that as well. And that's done through either the volunteers or eventually we'll get to it within a day or two, if it's us. So here's my contact information. That's my email, my office phone number. Amy, at this point, if you've got any questions in the chat room, now's a good time. Let me see if I can see it.
Thanks, Sean. At this time, there are no specific questions in the chat room that I haven't already responded to. And I've been collecting everyone's contact information. Thanks so much to everyone who has posted that. There are a few people who I have messaged individually to ask if you're willing to share your name if it's not obvious from your sign-in and or your preferred contact information. So if folks would take a glance at the chat box to see if I've sent them one of those messages before the end, that's great. I will presume if I don't hear from you in the chat box that you would prefer not to share at this time.
Yeah, it's one thing I'll ask. I'm sitting here looking at Scott's message. Scott, thank you for adding that. That's something I did not mention. Vertical 196 will be open during the daytime and act as a daytime warming shelter until this, the site-specific shelter opens up around 5 o'clock, give or take. One thing, Scott, if you could do me a favor and also put into the chat what a typical route would look like at this point in time, based off of what you've got set up so far. That will kind of give people an idea as to how, the area that we're going to be trying to cover during this upcoming season. So for those of you that, if you've got any particular questions that you don't want to enter in this format, feel free to drop me an email. I will get back to you, most likely tomorrow. But if there's no questions specific to this, what we can do, what I would recommend is we take a quick 5-minute break, let John get set up for his part of the presentation, and then we'll be back here in, let's say, 7:30, if that's okay.
And people can use that time as well to post questions in the chat box, and I'll make sure to pass them on. I'll make sure to pass them on before we get started with John's portion of the presentation.
All right, so thank you. As earlier, my name is John Weaver. I'm the Deputy Director for Lincoln County Emergency Management. Last year we did this presentation. It was my first time doing one over emergency shelter care, like the first aid section. So first of all, thank you to all the volunteers that are stepping up to operate these shelters if needed this season. All the information Sean went through, it is a lot of work. And then we add this component onto it. And the thing I'll repeat a lot tonight is we're not, if there are nurses and EMTs or doctors in the group of volunteers, thank you. You have, a step up, and you have, information already know what to look for some of the residents if they do come in. If not, this is just kind of an overview of what you could see in cold weather emergencies or cold weather in general if we're operating a shelter. This is this presentation I'm going to do is we're going to make it kind of quick, just overview, but this is by no means any way to diagnose somebody. Your safety is most important at this point. If you feel at all there's something you're not sure of, there's always, call 911, get, medical staff there, the squad there, get the professionals there to look at the patient or, the staff, or I'm sorry, staff or a shelter recipient, and get them further care if needed. So, fire department, also 911. When a task or a shelter is open for warming, or any kind of shelter that we operate or open up, the 911 center is aware, as well as police and fire. They're aware of the address and what's potentially going to be there. So when they do get called, they are aware. So we'll get started. If I'm going too fast, please stop me. Okay, so shelter operations involve many resources for a short amount of time that they are operational. Again, Sean covered a lot of that in the beginning, the startup, the process, and then the end. The time you spend in a shelter helping people can be the only time they get the care they possibly need. This is a time to know what to look for and intervene as needed. Again, overview. If you see something that doesn't look right, talk to the person and offer them help. Just a little bit of history from 2019, weather events that caused the most deaths. Winter weather, 144 deaths. Flood, 91, and heat, 83. flooding, heat, and winter weather are probably our three biggest around here. Weather events. In the earlier presentation I had, I talked about weather. The only one missing off here is severe weather, but winter weather I wouldn't think would be the highest, but in the weather event, 144 deaths, that's significant for what the elements would have been in 2019. Some of the problems we could see in these shelters, if homeless people do come in, hypothermia is the main one, chilblains, trench foot, snow blindness, dehydration, frost nip, and frostbite. A lot of the stuff you'll see tonight, I have some real pictures and some animations. A lot of the stuff looks very similar. And once again, if you're not sure, just try to get help there and let the fire department take the patient and treat them as their protocols allow. This one's, I'm going to go over the 5 methods of heat loss. We have evaporation, convection, conduction, radiation, and respiration. You can see the picture there, each method showing how the person's going to lose heat throughout their body. Can you read that okay? Anybody speak up?
Yes, it's readable.
Okay, perfect. So just again, there's a little information on evaporation, convection, conduction, radiation. Body heat and evaporation turns in liquid into water vapor. Convection, wind chill, cool skin faster than still air. Conduction, clothing conducts heat. Sitting in the snow. And then radiation, body radiates or leaks heat through rays of waves. And then respiration, conduction in the lungs, breathe through nose, use a neck gaiter, and so forth. There's a definition of hypothermia. It's defined as a body core temperature below 95 degrees Fahrenheit. It's usually characterized as mild, moderate, or severe based on body core temperature. In order to properly diagnose hypothermia, core temperature must be measured rectally with a thermometer with extended low-range scale. Again, this is something that would not be done in a shelter. You're going to know immediately when this person comes in if the temperatures are really low for a prolonged period of time, this person's going to need help. So at that point, it's probably a good idea to get the squad there, somebody that can treat this patient further than what we're going to do in the shelter. There will be thermometers, correct, at each shelter for, obviously that was something we didn't have. I don't believe they might have been in the kits last year, but this year it's, with COVID, they will be there. So it's just another tool in the kits. And speaking of the kits, when we get the kits to the shelters, we will go over the kits with shelter staff or whoever's available, and then they can pass it on. The kits are basic kits that have basic first aid and EMS supplies in them, but thermometers will be added. You'll be able to check temperatures really quick with them. They're no-touch infrared thermometers. But again, we will not be doing rectal temperatures at shelters. Oral and tympanic temperatures will not yield accurate results in a cold environment, even when care is taken to use the best technique. Again, it's still a tool. There's just some examples of hypothermia. I apologize, the pictures are small. The one right there at the top, middle, hypothermia wrap, that's going to be our best method in a shelter until we get additional help there. Wrap them in a blanket and apply heat. And they're going to look like a burrito. But blankets, pillows, heating pads, whatever. All right, chilblains is a non-freezing cold weather injury that can occur after 1 to 5 hours in the cold, wet conditions when skin temperatures are below 32 degrees Fahrenheit. The most commonly affected areas are the dorsal surface of the fingers, but the ears, face, and other exposed skin are also areas of occurrence. And believe it or not, there's no lasting effects from chilblains. When you see the pictures, you wonder how and why, but it's more common than I thought. And most of us have probably experienced it at one point or another in our life. If you go skiing or hunt, camp outdoors in the winter. There's some examples for toes, the fingers, the bottom of the feet. Symptoms: redness, itching and burning sensation, tender to touch, possible blisters, inflammation and swelling, ulceration in severe cases. Again, you might see this. At that point, it's up to you and the patient if they want further treatment. If it's something you think needs further evaluation, make the call. Trench foot is prolonged exposure of tissue, especially the feet, to wet, cold conditions at 32 degrees to 60 degrees. Inactivity in damp socks and boots or tightly laced boots that impair circulation. They'll speed onset and severity. This is another common one you will see, especially with not changing out socks, wet socks, dirty socks, shoes that are in pretty bad shape, that are not laced up, they're not tight, holes in them. These, I'll call them patients. These patients are going to be used to it. They're going to have this. I mean, this can happen, now, like on a day like today when it's raining, just some moisture in there for a long period of time. Again, you'll see these pictures. You'll see a lot of this, and just think of a severe case of if you've taken a bath as a kid and you wait till your skin shrivels up on your hands and turns white. That's what this condition looks like, only in a severe case. There's the feet. The bottom right there is a real severe case. That's to the frostbite. To me, that's to the level of frostbite, frost nip. Again, get the EMS involved if they're complaining of pain. But easy treatment of this would be, air the feet out, change their socks, and keep them dry. Snow blindness, inflammation and photophobia caused by exposure to the eyes and ultraviolet rays reflected from snow or ice. Again, we get a lot of snow on the ground, the sun comes out. Very common if they're not wearing sunglasses or some type of filter over their eyeballs, especially if it's long exposure being outside. The bottom left there looks like a homemade mask out of probably a mask that we, a couple years ago, would think, they're common, the procedure mask, or now it's something over the eyes outside. There, the top right looks like I categorized it. I think the thing I compared that to is like a welder's burn, or somebody that wears contacts, their eye itches. So you're not going to know with this. You're not going to know unless they're complaining of pain. But something you can do with the kits we have: loosely bandage the eyes with sterile gauze. You can wet the gauze with cold water to help with pain. Try to get them out of light, and then provide care over the next 24 to 48 hours, which is hard, being the shelters are only open for a certain amount of time. So once again, get EMS involved. And, we can't, I don't believe we're at the level we can administer over-the-counter pain medication. So we'll that one's, ignore that one. But once again, just get EMS involved with this if the pain persists and they're not having any relief. Dehydration, just a lack of water to the body resulting from inadequate intake of fluids or excessive loss through sweating, vomiting, or diarrhea. Dehydration, once again, is very, very common, especially now, cold and flu season. We don't know what their health was like coming into the shelter. They might be maybe are coming in the shelter to finally reach out for help because they have been sick for a long period of time. They're not getting the adequate water intake. I've been doing fire and EMS for around 19 years. I've been on many runs where patients are dehydrated, but they're alcoholics. And their mindset is they drink enough, alcohol is a liquid, so therefore they should not be dehydrated, and really the alcohol dehydrates them severely. We've seen severe cases of dehydration, and their body, compensates by starting to shut down. In this case, if they're out in the cold weather, their body is using as much as it can to keep their energy up, to keep them, the shivering and whatnot, to keep their body warm. So you're going to see you could see dehydration if we have long periods or long cold spells. there at the bottom right is a urine color chart. I'm not saying you have to go and analyze if they use the restroom to determine if they're dehydrated or not, but if they appear that way, they're going to act lethargic. They're just going to act sluggish, and they might use the restroom. If you have to go in and clean the restroom up, you might, if you notice they use the restroom, they didn't flush, that might be an indicator. But once again, get EMS involved. Okay, and frost nip is reversible freezing of superficial skin layers that is usually marked by numbness and whiteness of the skin. Frost nip and frostbite are two different things. Frost nip usually has no lasting effects. This is something a lot of us have maybe experienced in the past. There's some frost nip pictures. It's usually a first degree, they categorize as a first degree frostbite, partial freezing, stinging, treatment, just warm immediately. You know, the signs and symptoms are going to be redness, mild swelling, pale, and edema. But, you know, we don't want to submerge their hand like there at the bottom. Don't submerge it in boiling water. You know, keep the water warm, like, you know, lukewarm water. Obviously keep it fresh. Don't share water with other residents. Frost nip is cooling the skin tissue, usually of the fingers, toes, ears, cheeks, and chin. If you've ever been outside long enough without gloves or a hat on and you feel that little bit of burning sensation, or when you come in from being outside for a prolonged time and your hands are really cold and they start to burn, those are usually, you're in the beginning stages of frost nip to where you're almost getting that frostbite stage. And the people that spend a lot of time outside, if they're homeless or living, you know, from a tent to tent or a car, whatever, they might be used to it, and their body's going to get to the point where they might get to the frostbite stage, and they're not going to know it, and you're going to recognize it immediately to where this might all be normal for them, and it's unfortunate, but, you know, thankfully you can be there to try to intervene. So with frostbite, frostbite is categorized as an injury to body tissue from extreme exposure to cold, typically affecting the nose, fingers, and or toes, and sometimes resulting in gangrene infection. I think Sean mentioned earlier, but one of the kits that we have are the hats, gloves, and socks kit that the shelters will be provided. You know, those are gloves, hands, socks, feet, hat, head. Those are your points of your body that you lose the heat, and those are the points of the body that are going to get the frostbite first, or back to the trench foot. Some of these pictures, I apologize, some of these pictures may be, I don't know how good these ones are, but there's some severe cases of frostbite. Obviously, the top left, those are loss of fingers. I mean, those fingers will be gone. Bottom left, those probably be lost. The two foot pictures, those are severe cases. Those will heal with infection. But something you can do in a shelter, and I suggest if you come across something like this, again, and I've told you 100 times already, call 911, get, you know, medical intervention involved, because these people probably need to go to the hospital, see a doctor, get put on antibiotics, and get the treatment that we're not going to be able to provide at the shelter. You know, the thing you can do while you're waiting, rapid rewarming at temps slightly above body temperature. You can rewarm until the skin is pliable. No dry heat. Don't put them by a stove or, you know, no rewarming with exercising or rubbing. Just don't touch the area. Do not rewarm in the field if there's a risk of refreezing, so they're indoors. And try to protect them. So if they want to lay down, and they protect them from further injury, pad the protected area if it's their foot. Don't let their foot rest directly on a, you know, like in hospitals, if somebody lays in bed long enough or, you know, they get bed sores or pressure sores. You can loosely wrap it with gauze and elevate. One of the bigger things you can do is remove wet and constrictive clothing. If we're going to remove clothing, you know, have a means of being able to cover them up quicker. Do it in, obviously, somewhere in a private setting where they're not exposed to other residents. There's some treatment tips for each one of these. Feel free to read these. I think these presentations will be available if you want to look through them again. You know, hypothermia, remove wet garments, chillablands, Unfortunately, chilled lands responds poorly to treatment. Best thing for that is see a doctor, keep affected parts as warm and dry as possible. Snow blindness, do not allow any exposure to light. Frost nip, gently rewarm affected area by blowing warm air or placing against a warm body part. Trench foot, gradually rewarm. And then dehydration, fluid replacement, frostbite, rapid rewarming. Then we get down to the narcotics, all the stuff that they need to see further medical attention. Principles of care needed to maintain bodies. Some prevention tips. In World War I, the British decreased trench foot cases from 29,000 in 1915 to 443 by sock changes. Again, the socks are very important. A little plug real quick. Last year, and I don't know if Scott Hayes from Vertical, I don't know if Scott's on here. The hockey program that I'm involved with, they did a sock drive, and I'm not sure how many pairs of socks. We had a sock box up at the ice rink for about the whole season, and there was a lot of socks donated. One of the teams did a sock donation. That's something else that can still happen. Socks are very inexpensive, and it's something that can go a long way if we're sending people out of the shelters, if we have donations of socks, hats, and gloves or whatnot. If there's things we can do to cover the head and neck, that's 80% of your heat lost right out of your body in synthetic fiber materials. This is information too you can pass on to if people come to the shelter and use the shelter. Nutrition, 3,000 to 4,000 calories a day. If you're outside in cold weather, your body's shivering, you're burning calories. Adequate hydration and rest, adequate clothing. And it's going to be hard to tell them to spend prolonged, time outside. Try to keep them indoors if they have a way of being indoors. The standard shelter is a tent, but improvised shelters, lean-tos can be constructed from local materials using existing buildings when possible. Use a tent liner for better insulation. In tents, sleep in long underwear, socks with hat, and all their clothing hung up to dry. Ensure adequate ventilation to avoid moisture. Again, this is just information you can pass along. And prepare an insulation layer between ground and sleeping bag. Try to, let them know to use the restroom before they go to sleep. This is after they leave the shelter if they're going to spend time outside during the day. Eat some candy, anything with high fat before you sleep. It'll give their body energy to, try to keep warm. If they have a water bottle, if they don't have a water bottle, see if they can have a water bottle, fill it and put it in the sleeping bag so it won't freeze. And then, obviously, here's some information dressing for the cold. Thick socks, thick pair of gloves, head and ears with thick hat, and a heavy coat if available with a hood. And then finally, some key points. Eat and drink more food and water than normal. Load up on snacks if leaving a shelter for the day. If the snacks are available, little snack kits can be passed out if you have that capability. Be prepared, advise be prepared for sudden weather changes. With Ohio weather, it can be 20 degrees today and 55 degrees tomorrow. In the cold, it can be 10 degrees, and then the next night be negative 20. A lot of the people you may see, the buddy system will work for them. They're not always going to be alone. And immediately treat person showing any sign or symptom of a cold injury. Be sympathetic with them, talk to them. A lot of them may turn down the care, the treatment, but, let them know you're doing it for their own good. They're not in trouble. They need to get the help. So they're, with infection and whatnot, they can get worse and they're going to spend more time in the hospital. And just being re-exposed to the elements can make it worse. Passive external field warming options. There's more information, And then closing, here's some information on some homeless care packages that can be given out. And I've seen these given out in the, other places I've been to, other trainings we've done. These are good little, if you have a group looking for a service project, if you have somebody reach out and say, hey, what can we do to help? Pass this information on. These items are inexpensive. To put one of these little kits together, it's about each item. If you put a kit together, each kit's roughly, last year when I did this, it was about 75 cents per kit if you bought this stuff in bulk, which is really, for one kit, yes, it's inexpensive. If you're making hundreds, obviously it costs some money, but these are good little sending out as they leave your shelter. This is something that'll get them through the day. And that's it. Is there any questions for me? There's my contact information. Did you add that on there? Thanks. I didn't think I put it on there. Sean did, so I didn't even spell my last name right.
Okay, we'll make a last call for any questions that anyone has.
Yeah.
Give people just a minute to either type something in the chat box or unmute themselves and ask it if they have anything before we conclude the training for tonight. I did put a message in the chat box for everyone on behalf of the Disciple Factory. Pastor Critter, who is on the who is in the Zoom meeting tonight, intends to have a training specific to his location this coming Friday. So I've included his phone number if you'd like more information or possibly to attend as a prospective volunteer for that site. You can contact him. And we do have one question. Sean, can you speak to how the shelter and the cots will be sanitized?
Yeah, typically, Amy, there's a cleaning solution that's just sprayed onto the cot and allowed to dry. Nothing needs to be wiped down. You're just kind of hitting it with it, with the solution, and that's it. There's a couple of different solutions available.
And then the shelter more broadly than just the cots, the shelter itself?
Shelter itself would be up to the site to handle. If they need additional help, they can come back to the task force and, request grant money through us, through the executive board.
And am I remembering correctly that the Salvation Army in particular, who is a member of this task force, has been conducting shelter sanitizing all along throughout the entire pandemic and has offered their resources to help as needed?
Right, especially with the laundering of the blankets. They have a high heat dryer that will actually kill any bugs that are in there. So They can be reused.
And then can you restate what the mask policy will be? There was also a question about that.
Masks will be provided, but masks are highly encouraged in accordance with the state rules. Now those could change, but I think at this stage of the game, as we come through this season, we would still encourage it. Of course, it's going to be up to the individual site if they want to enforce it, if a resident, doesn't want to wear one. We'll support the site in that particular instance.
Okay, I see no additional questions at this time. So want to thank the presenters, want to thank everybody for attending, and want to encourage everyone to take Sean and John up on their offer to contact them directly if they have additional questions as you think through the information that you've heard tonight, and a reminder about the potential for a training specific to the Disciple Factory location, and that contact information is there in the chat room, so you can get that phone number before we end the meeting here if you need that information. feel free to reach out to Sean as well. He will have that information and can provide it to you. Thanks so much, everyone, for spending some time with us this evening. This is an important course for the community, and it can't happen without volunteers like all of you.
Thank you, Amy, for hosting this. We appreciate it.
My pleasure.
All right. Good night, everybody.